Good morning, everybody. This is Dr. Lee with another episode of Dermpath Made Easy. And today we have a case of angiolymphoid hyperplasia with eosinophilia. Another name for that is epithelioid hemangioma, or you may hear it called histiocytoid hemangioma. So let's get into it. Clinically, these lesions present more commonly in individuals in the middle adulthood to later adulthood. They occur more commonly on the head and neck, although it could be, you can find cases where they're deeper in tissues and other sites. So let's take a look at it clinically now. You can see that their erythema is sort of multinodular, or sometimes you can get solitary nodules on the head and neck, and this individual looks like an older version. This is taken from JAMA off of Google. And, these things are usually biopsied for, rule out basal cell carcinoma when they're solitary or hemangioma, and you can see occasionally they can even ulcerate. So let's come take a look at histopathologically what we have. So from a low power perspective, a few things that you can tell almost immediately about this case is that we have if you look here off to the lateral edge, you can see small diameter hair follicles. So these are villus hair follicles. And villus hair follicles are usually found in the head and neck. So that's a good tip off there. And we have this big nodule, right? Big nodule surrounded by this blue cells. The blue cells, when you see that, we're usually dealing with either lymphocytes or plasma cells, right? And towards the center of the lesion, you can see that there's a vascular proliferation. So what I usually like to tell the residents and fellows is that when you see a vascular proliferation that's inflamed, you want to think about, pyogenic granuloma first, but also the other thing to think about is angiolymphoid hyperplasia with eosinophilia. So the characteristic feature here is if you see towards the center here, we have a large diameter, medium diameter vessel with fairly thick walls. And so this is the wall here. And you can see that the endothelial cells are very, very prominent, and they protrude into the endothelial, into the blood vessel lining. This process is called hobnailing. And occasionally you'll find that some of the endothelial cells are so large that they look epithelioid. That's why it's also known as epithelioid hemangioma. Occasionally the cells will look histiocytoid. So because of that, it's also known as histiocytoid hemangioma. And then as you come out from high power, you'll see that there is a peripheral radiating proliferation of smaller diameter vessels, but they also have pretty, vessels that are protruding into the lumen, hobnailing into the lumen. And then if we go further out, again, we have more vessels, and we have the lymphocytes that we were seeing from low power. And admixed with those lymphocytes, you can see numerous eosinophils. So the combination of vessel, central vessel, large diameter, hobnailing cells, peripheral radiation of smaller vessels, and then lymphocytes and eosinophils, those are the main diagnostic features for this case. Okay, let's look at another example. So this is all the cases today are actually taken from Path Presenter. I didn't have any of these cases when I decided to teach this. So I just, they're a great resource. They have a slide library that has a bunch of cases. I would certainly suggest you guys to go over there and take a look yourself. So again, we have this lesion here is a nodule, and we have multiple kind of nodules here with lymphoid aggregates and blood vessel proliferation. You can see the blood vessel proliferation because, those spaces that you see in the tissue, those are blood vessels. And here you have a larger diameter vessel. Let's come take a look at there. The larger diameter vessel, these are just endothelial cells, and out here, this is the vessel wall. And again, we have the same kind of feature with these protruding endothelial cells, some of them looking histiocytoid here. And then we have some already here, you can already make out eosinophils. So coming back out, we have a peripheral radiation of the smaller luminal diameter vessels, smaller vessel walls, but similar kind of pattern. Let's look at one more example here. In this example here, you can see that, again, a large wall vessel in the middle. Let's come to high power. The vessel walls are lined by hobnailed, protruding endothelial cells, some of them appearing histiocytoid or epithelioid, like right here. Let's come back out, and then you have a peripheral radiation of smaller vessels, and then cuffed by a inflammatory blue ring of lymphocytes and eosinophils. So that's three cases that almost appear, very, very similar to each other. Now, the one lesion that people occasionally confuse with this, look, here you can also see that this is in the head and neck again because we have numerous small diameter villous hair follicles. Okay, that was a sidetrack, but going back to our, the one lesion that people most commonly confuse with this is Kimura's disease, and for good reason. Here's a clinical picture of Kimura, and you can see that these lesions they're usually much deeper than angiolymphoid, although angiolymphoid can be deep, and they're massive. You can see there's this massive swelling, commonly like in the distribution of almost lymph node-like. Here, probably the cervical lymph node distribution. And histologically, they look a bit different. So low power, you can see that there's no clue that you are even anywhere near skin. This is in the subcutis, obviously. And you have subcutaneous fat out here. And then you have this large nodule. This nodule feels bigger than the last case, spattered by numerous lymphoid aggregates, right? Lymphoid aggregates everywhere. It's not just around the periphery, it's everywhere. So this one has much more significant lymphoid tissue. It does have a vessel in the middle, but any tissue requires blood vessels to support the tissue, so you would expect at least some blood vessels, but far few vessels than the other case, right? There's none. We don't see any vessels intervening here. And as we go higher power, you can see that these are beautiful lymphoid aggregates. We don't really generally see that in angiolymphoid. And again, lymphocytes and eosinophils. So from a high power perspective, these two lesions look almost identical. You can't tell the difference. But from a low power perspective, you know where you are anatomically, you know what portion of the skin that's involved, and the absence of numerous vessels everywhere else and a bunch of lymphoid aggregates like this, you're pretty, you have a good guess at that this is Kimura's disease not angiolymphoid hyperplasia. So to summarize, angiolymphoid hyperplasia or epithelioid hemangioma, typically in the head and neck in individuals, older individuals, 30, 40, 50 years old. Usually that's the common occurrence. I always like to tell residents and fellows that you have a vascular proliferation, and if it's inflamed, think about angiolymphoid hyperplasia with eosinophilia. And in this case, we have a large walled vessel with protruding endothelial cells. Occasionally, you'll see the histiocytoid nuclei or epithelioid nuclei, and then you'll have a radiating sort of smaller diameter vessels or smaller walled vessels around it. The lymphoid aggregates have the lymphoid tissue. You don't really see great sort of germinal center or lymphoid aggregates, but you have this peripheral rim of lymphocytes with eosinophils. So that's what makes this diagnosis. Thanks, everybody. If you guys have liked this, please subscribe and share it with other people that you may think this would help. It would really, I just want to spread the news, and this is another great way to learn pathology and dermpath. So check out Path Presenter and invite your friends. Thanks very much.